Hello, my name is Kayla Chase, and I am presenting to you from the Department of Veterinary Clinical Sciences at the University of Minnesota. Today, I will discuss with you how T1 row and T2 mapping detects ischemic injury to the femoral head in a piglet model of Legg-Calvé-Perthes disease. Legg-Calvé-Perthes disease is a juvenile hip disorder affecting both children and dogs, caused by an interruption of blood flow to the developing femoral head and can result in severe joint deformity. Clinically, there is a need for non-invasive imaging techniques to detect ischemic injury in dogs. The ability to intervene early would assist in early diagnosis and preserving the sphericity of the femoral head, thus halting deformity and associated pain. Our work is focused on addressing the early injury phase of this disease. The purpose of this study was to evaluate the sensitivity of T1 row and T2 mapping to detect ischemic injury to the femoral head in an induced Perthes disease piglet model. It was our hypothesis that T1 row and T2 relaxation times would be increased in femoral heads undergoing ischemic injury compared to unaffected contralateral hips. Here you can detect both gross and radiographic differences between normal and diseased femoral heads. To conduct this study, 8 6-week-old piglets underwent surgery to induce unilateral global femoral head ischemia by ligating around the femoral neck and transecting the ligamentum teres. 1 week post-operatively, the piglets were imaged in vivo at 3T MRI using 3D T1 row and T2 mapping. Ischemia was confirmed in all 8 piglets using contrast-enhanced MRI, and the extent of injury was histologically assessed. T1 row and T2 maps of the femoral heads were segmented into 4 regions of interest: the secondary ossification center, SOC, articular epiphyseal cartilage complex, AECC, primary physis, and metaphysis. The median T1 row and T2 relaxation times in each region of interest were compared between operated and controlled femoral heads using paired t-tests, with p less than 0.0125 considered statistically significant. Ischemia was induced by ligating the ligamentum teres and retinacular arteries supplying the femoral head, as depicted in this diagram. All regions of interest are also outlined for visualization. By observing MRI color maps, we can identify a clear increase in T1 row and T2 values in both the SOC and AECC in the operated versus contralateral control femoral heads 1 week after induction of ischemia. Histological analysis using H&E staining found clear evidence of diffuse necrosis of bone marrow cells and chondronecrosis in the SOC and AECC in all operated femoral heads. Osteocyte necrosis is also visible in the bone of the operated femoral heads. Our quantitative analysis further presented significant increases in the operated heads in the SOC and AECC. There were no statistically significant differences in the metaphysis and primary physis regions, which was expected. Our findings support our hypothesis that T1 row and T2 mapping are sensitive and potentially clinically translatable techniques to detect early-stage ischemic injury to the bone, bone marrow, and cartilage of the femoral head. Median T1 row and T2 relaxation times were significantly increased in the operated femoral heads in the SOC and AECC when compared to the control femoral heads. Histological analysis found clear evidence of diffuse necrosis of bone marrow cells and chondronecrosis in the SOC and AECC in all operated femoral heads. These findings corroborate our prior ex vivo studies showing T1 row and T2 sensitivity in detecting ischemic injury to the femoral head as early as 48 hours after surgical induction of ischemia. Our future work will focus on investigating the cellular changes driving the sensitivity of T1 row and T2 mapping to early stage ischemic injuries, the response of T1 row and T2 to disease progression and repair, and application of the techniques to other types of osteonecrosis. Thank you to my project mentor and to other contributors from the University of Minnesota Veterinary Clinical Investigation Center. Thank you for your time today, and please reach out to me if you have any further questions.